This building in Sarasota, Florida, sunny Sarasota, Florida, may be the best kept secret in all of medicine. Wait till you see the programs in alternative medical care that are available here. Come with me, let me show you. It all starts on the second floor. Come on. At the end of this hallway may be hope for you. And let me define hope. Helping other people escape. It's time. Let's go. And this is where the magic happens. We're in the lobby. This is where you'd come to get registered. And this is Luba. If you could hand me the registration form.
There you go.
So the first thing you'll notice, thank you. First thing you'll notice, it's comprehensive. You don't just say, have you had the flu, yes or no? People that are here are dealing usually with late stage illness of one kind or another, and we got to have a lot of information. So they get that all filled out, thank you. And then they relax in a comfortable waiting room. The nurse comes, of course, to get them. And you have your session with Dr. Monholland, which can last, what, an hour or more?
Yeah, an hour, 90 minutes.
Okay, an hour, 90 minutes, so there's a lot of questions. And it's comprehensive. Let me share with you what I think is an exciting feature of the practice here is that they collect patient testimonials. And what's really cool, check this out. I mean, handwritten testimony. Are you watching this? Testimonials from people that have been here and are willing to say, I got help. And people say, well, this is just anecdotal. This is just anecdotal evidence. Well, if I'm gonna go somewhere and I want to be treated effectively, I want to know that somebody did it before me, that it actually worked for people at one time or another. And sometimes when you ask doctors, they go, when I asked a doctor at the Mayo Clinic, how many people have taken the chemotherapy you want to give me, how many are still alive? Crickets. That's what I heard. So this is good news. This is what you want. By the way, here's something you don't hear often. Our videographer, our camera person today, is a patient here at the Florida Integrative Medical Center. And his testimony is that this place saved his life. And so I want to we'll have him do a selfie sort of and ask him, is that true or are we overstating this?
When I was 45 years old and had been married for 3 months, I was told that I needed a quadruple bypass, and it failed. 3 of the 4 grafts I was told didn't work, and my only hope was to get on the transplant list. At that time, somebody said, try chelation. After 6 months of intensive chelation therapy, I went back to the same cardiologist, and he said, you must have grown new collateral arteries. So I left that cardiologist. I continued to do chelation, and I believe that coming here has saved my life.
Most of us have heard about hyperbaric oxygen chambers when people are scuba diving and they go too deep and then they come up from the bottom too quickly and they get the bends. And the solution to that is a hyperbaric oxygen chamber. Well, we have that here as well. And that's because the cancer person, cancer does not do well in a highly oxygenated environment, according to the doctor. So let me take you in here and show you what a hyperbaric chamber looks like. There is actually a patient inside. We're not going to show the patient, but this is the chamber, and they just climb in, they zip it shut, they put the straps on, but after an hour they release you and you've got all this good oxygen in your system, and it's hyperbaric chamber. We're talking with Dr. Dick Chapman, and he is operating out of the exact same building in this practice with Dr. Monholland. And maybe right out of the blocks, have you define integrative dentistry? Because I don't know what that is.
Well, integrative dentistry is the newest study of dentistry. It approaches dentistry from many different directions. It's on the cutting edge right now. It includes things like biological dentistry, where we study DNA of infections. We look at the bacteria in gums and under a microscope. It includes toxicological dentistry. We make sure the materials are safe, whether it be materials to make a partial. We try to avoid metals for the most part, cobalt and sometimes mercury and those kind of things. We don't find them. And also, actually, a lot of white fillings. But one of the things we also do is we look at allergies. And allergies are important. A lot of people are reactive to dental materials, especially the complicated modules, but also the molecules, but also the individual plastics have a lot of different places where you can react. So one of the things we do is we do a reactivity test, and it's a blood test. Today, our composites work extremely well. Most of them are good.
Durable.
Very
safe.
durable, the low solubility, they don't seem to dissolve, and they have a tendency to make the teeth stronger. The basic preparation, you don't have to be as radical. And I try to work with as many people as I can and learn as much as I can, because this is a lot of new information coming out every day.
Tell me what the elephant tusk is over here.
Okay, this is a device that has a filtration system which is used when you remove mercury fillings. And what you do is, as you take a filling, you isolate the filling, and this suction will pull the vapor down into the machine, the filter, which is changed routinely. Well, but we do a lot of preventive work, and that's definitely the best angle before you're running into problems, is to, rather than crisis medicine, make sure the materials you're using in your mouth are safe. Now, this is, according to the Dental Association, everything that's basically used out there is safe. So this is another degree of refinement.
Yep.
And
It's evolution.
It's evolution. Yeah, things are changing.
Dr. Dick Chapman, thank you very much. I see you've got patients out in the hallway jumping from foot to foot. Thank you very much for meeting with us.
Enjoyed talking to you.
In 1974, when I was undergoing treatment myself, one of the things that they did to help get me well was what they called detox. And by that I mean I did colonics and juicing and fasting and different things like that. And of those that I mentioned, the only one that people go, I don't know, is of course the high colonics, the hydrocolonics. And people feel that way because they misunderstand it. They've never looked at the equipment. They don't know how well it works. And a couple of things, it does not hurt. It is not embarrassing. There are no odors that are generated. And I'm getting the cookies on a shelf where you can reach them here. I'm telling you things that most guys making videos are not going to do, because I'm a former patient. And I want you to detox. And I want you to get rid of the fear that usually surrounds the subject of high colonics. So the first thing I want to show you is the equipment. This is all filtered water, and they have to sign things that say the filters are changed regularly. The place is inspected. The federales come down and inspect this room, and the water basically comes out of the unit. This is what is inserted into the patient. Does not hurt. It is sterile. Everybody gets a new one. And so warm water flows into the patient's bottom. And when they start feeling full, then they release it. And through that same hose, you don't have to get up and run to the bathroom. Through that same hose, the exit happens, and you begin to move things out of your system that sometimes people say have been there for years. Some people only use the bathroom, once a week, and that is not normal. That is not the way it should be. Look at babies. Babies go every time they eat. And so what happens is the patient lies down on the bed, they roll over that way facing the window, the tube is inserted, then they come back on their back, they're covered with a sheet, and then the colon therapist simply adds water or shuts it off. Takes about an hour. Again, there's no pain. It gets a little uncomfortable when you have to release, but I have done, and I'm trying not to exaggerate here, which I love to do, but I'm guessing that I've had 100 of these in my lifetime. And I think it's important, very important. What if you could go to a doctor that has been in business for over 30 years, he's seen over 100,000 patients, he's an author, and has literally set the bar for what's called viral immunity. Here's a book he wrote. You can get it on Amazon.com as well as other books. Let me read this to you. A 10-step plan to enhance your immunity against viral disease, wait for it, using natural medicines. And his name is Dr. J.E. Williams, OMD.
Well, I've been in practice for 30 years. However, I started before that in biology, anthropology, medical anthropology, lots of field work and investigational studies with plants, with the Native American people and with the indigenous people in the Amazon, which I still do, by the way.
You go to the Amazon?
I still go to the Amazon. I was just there a few months ago with the Shipibo Indians.
Really?
Yes, I was.
How often do you go?
I go at least once a year. I began with a connection to try to understand what we might be missing in modern society in terms of the ecological events of our time. I founded a clinic in San Diego before I came to Florida called Ecology Medical Center. So we were working on what's the interface between the environment and our health. All chronic disease has an immune system breakdown aspect of it.
Okay.
So all chronic disease patients, and cancer patients in particular, where my main emphasis is the Lyme disease patients, chronic Epstein-Barr disease, the chronic fatigues, the fibromyalgias, also the influence of infections, chronic infections on the nervous system, so the neurodegenerative disorders, and of course because I have a background in boosting immunity, then all cancer patients, all Alzheimer's patients, all aging. My background, my clinical doctorate is in Oriental medicine, and I'm also board certified in naturopathic medicine, and I'm one of the first fellows of in integrative medicine. So back in the 90s, already looking at anti-aging, the early 90s, we're finding what works and what doesn't work. So we have the fundamentals, we have the diet, we have detoxification, and we have hypernutrition, so we do it intravenously, by injection, and by oral supplementation. So we enhance the wellness of any individual, and especially the chronically ill.
Tell us one last time where people can get your book and the titles again, because they're going to want to research.
All my books are available on Amazon.com, BarnesandNoble.com, or in the stores.
Okay. His name is Dr. Williams, and we're glad he's here in Sarasota. Came down here to help people live longer and healthier lives. Thank you very much.
You're very welcome.
All of us from one time or another have seen biofeedback equipment that's been demonstrated for us, or maybe we've even used it in years gone by. Well, today the technology has moved much beyond that. And here we have a machine called Untitled, and we're going to get a demonstration of this today, how it works here. And Susie Shu, our technician, will give us that explanation. So we're happy to have Susie showing us what's available here.
Untitled is a German engineered technology of a biofeedback machine, and it uses wave impulses. It's actually Latin for wave. It's neurological stimulation for pain and circulation. It promotes relaxation.
Okay, thank you very much. Just want to introduce our viewers to your therapy, how it applies.
Great.
So have a seat and we'll get started.
Okay, thank you very much.
I'm afraid to sit down in front of you. You know how people should move. So you were with the American Ballet Company
Yes.
Theater and spent how many years in ballet?
I had about 10 years of professionally dancing, and several of them in New York City. I got to travel all over the world. It was a wonderful career. I loved the opportunity to perform, and so then when I moved into movement and following my here. I brought everything that I had learned and experienced as a ballet dancer into that.
And how does that affect health? Because this clinic is an integrative medical establishment.
I think of actionomics and movement as your first cornerstone of health. Because how you move is how you feel, how you engage your mind and body to move in a healthy way.
So Mona Baker is available at the Florida Integrative Medical Center.
Yes.
Call here and schedule your appointment with Mona, and we'll look forward to that.
Okay.
Thank you.
Thank you very much, Ricky. This has been lots of fun.
Everything that you've seen on this video so far and everything that you will see is a brainchild of one physician, Dr. John Munholland. So tell us a little bit about you've been board certified in family practice for how long? And
I graduated from medical school in 2000, so that's 14 years. I did 4 years of residency, and so I've been board certified for 10 years.
okay. You got interested in this as a child. How old were you when you decided, I'm not going to eat sugar?
12 years old.
That is unbelievable.
My dad brought home a magazine with this article said, you guys have to read this. It's unbelievable what sugar does to you. So I read it because my intention was to be a wise person. So sugar had to go.
And then you got to hear Dr. Gary Null in person when you were like 18 years old, and you made a second major decision about your health.
Listening to Gary Null talk, and I was so impressed with what he had to say. And I actually kind of stumbled onto him because I saw him in person.
You were at a shopping mall.
And there was a radio station there with a glass front, so you could see who was being interviewed in there. And there were benches out front. You could sit and you could listen to what was being said and watch the guy. And this Gary Null fellow, he was 38 years old at the time, 30-some books, at least one doctor's degree, radio show, athlete. He ran mega marathons. It's the 50-mile marathons. So I had to listen to what he said.
Let's talk about a couple of the technologies that you're using. We don't want to get technical here, we just want to show them. The first one here, if you'll explain this machine, and how does it work and what does it do?
Okay, this is ultraviolet blood irradiation, and actually it's pretty low tech. And by the way, I think that low tech is often the best medicine. So this is a good example. They started using this in the 1890s, and in the 1930s it was gaining popularity as a way to fight infectious disease. It's a very simple technique. We draw blood out of the body, and then the blood drips back into your body over 45 minutes to an hour, and as it drips in, it's passing by these ultraviolet lights. So the blood goes through there. Ultraviolet A is shining from the top, ultraviolet C is shining from the bottom, and it goes through a crystal cuvette that flattens out the blood, so there's better exposure as opposed
More
to
surface area.
around two. Right. And the ultraviolet A and the ultraviolet C create a field that separates the blood elements so that all the individual blood elements are better exposed to the light.
And then we're in the infusion room, and they've seen how big it is and all the different things, but maybe you could explain a couple of the intravenous protocols that you use and what they do.
Okay. We do a large variety of IVs. The most popular, I think, is the Myers cocktail, and this is a combination of high dose vitamin C, high dose of magnesium, along with the B complex vitamins. We also do chelation therapy. This would be EDTA, and the value of this is it dissolves the plaque out of your arteries, so it improves blood flow. So if someone were told they have heart disease, this would be a good place to start.
So this is what you gave our cameraman.
Right. Doing the chelation, you're treating all of your arteries, your 75,000 miles of arteries in your body. It's all being treated by the chelation, as opposed to the bypass surgeries where they're just treating a couple inches of artery. It just makes sense that you would try this first, and maybe this is all you'd need. But even if you end up doing something more invasive later, this would be something to do in conjunction with that.
One of the questions that often comes up with cancer patients specifically is if I want to take chemotherapy, my oncologist has me on a chemo regime, is it better for people? They get less toxic response, better result from any chemo that they're using if they use some of these modalities along with the chemotherapy they're using.
I'm a strong believer in integrative medicine, where we're combining conventional medicine with alternative medicine, blending it together so that we have whatever works the best for the patient. Particularly when it comes to cancer, I think this is really important. Step one is we all should be thinking about being on the anti-cancer diet, whether we have cancer or not. I think we're headed to a point in time we're going to be working together, and oncologists will probably be doing in their office a lot of what we're doing here. But when it comes to cancer, I believe you have to have your immune system engaged fighting the cancer, because your immune system is really set up to do that. You have cells specifically designed to look for cells that are becoming cancerous so they can be eliminated. Right, and the sugar thing, you mentioned the 7-Up, but sugar feeds cancer. That's the whole metabolic basis of cancer. It metabolizes sugar and not oxygen, and so I believe that's step number one, is get the sugar out of the person's diet. We support the immune system basically two ways. One is detoxify the body and nourish the body. So almost everything we do here can fit into one or both of those categories. Well, I like the idea of the medical rejuvenation vacation. Well, the best time to treat illness is before you ever get the illness. So I would say a healthy person should come to Sarasota, stay with us, and we can teach you the diet, serve you the diet, learn the lifestyle for maintaining your health, and then just come to see us once a year. So if you want your vacation to boost you up and extend your productive years, you do a medical rejuvenation vacation. Yeah, we do all these treatments by day and evening. Enjoy the sights and sounds of Sarasota.
His name is Dr. John Monholland, and he is here in Sarasota, ready to take your calls, ready to talk with you about better health. My name's Rick Hill for the Florida Integrative Medical Center. Thanks for watching.